The U.S. is inching closer to President Biden's 4th of July coronavirus vaccination goal. Just over 60% of U.S. adults have received at least one dose of a vaccine, and nearly 40% of the entire population is now fully vaccinated. Dr. Anthony Fauci says if the current pace of vaccinations continues, the U.S. may be able to ward off another surge. But as Nikki Battiste reports, health experts and vaccine makers are still preparing in the event that booster shots become necessary.
Tonight, a COVID vaccine booster could be necessary by fall for people who are already fully vaccinated.
I believe in 1 to 2 months we will have enough data to speak about it with much higher scientific certainty.
Dr. Anthony Fauci says the vaccines are effective for at least 6 months, likely more, but boosters will probably be needed.
It's really going to depend on following what the durability of immunity is and essentially recommending it at an appropriate time.
The first dose of Pfizer's vaccine in the U.S. was administered 5 months ago to a critical care nurse from New York. This comes as states scramble to get the first dose into arms.
We have the Moderna vaccine.
In Philadelphia, where demand has slowed, the city is going to the community.
I feel safe now.
Today, there was a twofer on offer, a shot and a free meal.
We're just not going to get back to normal unless we take care of the folks who, may be homeless or struggling with poverty.
How are you today?
In Rhode Island, nurse Angela Flynn went door to door to vaccinate the homebound.
As soon as they see you with that cooler, their face lights up.
She gave shots to Patrick Gallagher and his bedridden wife, Karen.
It would be very difficult to get her vaccinated if it weren't for this program.
Gambling on getting more shots into arms in Maryland. The state launched a lottery for vaccinated residents today with a $40,000 prize.
We'll continue to do this every day for 40 straight days.
Here in Philadelphia, there is still an indoor mask mandate until at least June 11th. One reason is that more than half of the city's population is still unvaccinated, including about half of firefighters and police workers. Lana?
All right, Nikki, thank you. Internal medicine physician Dr. Stella Safo joins me now. Dr. Safo, thanks for being here and for all that you do. So let's get right into the CDC data, which shows that the daily average of coronavirus vaccinations has slowed more than 40% since mid-April. What do you make of this pace?
I think the pace is pretty remarkable. We had expectations that we'd be reaching this goal, quite a bit later. And I think the initial reinforcement from the federal government allowed us to hit the markers that we hope to hit and to actually set new ones. And so the vaccination rate is good. I think the question becomes, are we vaccinating the communities that are most vulnerable at the rates that we should? And as the story just mentioned, we're seeing the rates kind of start to fall in a lot of areas. And so we really need to figure out how we're going to redouble those and meet the people who are most vulnerable.
Yes, and as you mentioned, we just heard Nikki say that there in Philadelphia, that the rate of vaccination is a little bit lower, and a particular concern was the firefighters and police officers that were not getting vaccinated. Why is that so significant?
So, the issue really becomes how much COVID you have in your community that can spread to people who are not vaccinated. And for those individuals who are frontline staff, like firefighters, police officers, they're going to be interacting with lots of other populations that may also be high risk, the unsheltered population, individuals that, are in and out of jail. And so it really brings this question up, are you going to end up in a population where you're allowing certain amounts of local spread to happen? It really does matter that we get our frontline staff vaccinated as soon as we can.
Dr. Fauci told the Washington Post on Thursday that if we reach President Biden's goal of administering one dose to 70% of U.S. adults by the 4th of July, that the U.S. might be able to avoid another surge. How are you viewing our prospects? Are we in the clear when it comes to additional surges of the coronavirus in this country?
The sad news is we're definitely not in the clear. So a lot of the times what we're looking at is aggregate data. We're looking at population-wide data for all of the U.S. And what we really need to be thinking about is what's the local situation. And so while in San Francisco, you may have really great numbers where your COVID prevalence has gone down, in other areas, those numbers and those pockets of infection may be high. And so the kind of goal then is to think about what's the local work that we need to do to make sure that we're able to address what that local environment is seeing. I think Dr. Fauci is, hoping for what many of us are hoping for, which is rates that would match what we've seen in some countries that have done a good job with vaccination, the Seychelles and a couple of other places that have gotten over 60%. We're right now almost getting to 40%. If we were able to get to 70% and keep our community transmission rates of COVID down, I think that we would be looking at a summer where we could all kind of breathe a little bit easy. But until we kind of get, at least above the 50% mark, I think many of us on the front lines are still kind of nervous about what could happen for folks who are unvaccinated.
Well, as we are well aware, what happens elsewhere in the world affects what happens here in the U.S. So I want to shift our attention to the international fight against the pandemic. Brazil has detected its first case of the coronavirus variant that was first identified in India. That same strain is also spreading in the U.K. What have we learned about this particular variant, and should we be concerned here in the U.S.?
So this variant is doing what all the other variants have done, the Brazil variant, the South African variant. It's making us question, one, if the vaccines that individuals currently have will work against this variant. The answer for now seems to be we think so. And it's making us question if this variant is more infectious and more mortal if you are to get it. And it also looks like, again, this strain is something that is more harmful as it's spreading. This really sets us up in that kind of back and forth that we've been doing, which is we're trying to get more individuals vaccinated to bring down the spread of the COVID virus itself within our communities, so that we can avoid what's happening with the India strain, which is the more that the virus can spread, the more we're going to see these strains. And the fear is that we may get a strain that is powerful enough that it kind of undoes the work that we've gotten to do with vaccinations. And so if you ever kind of hear the intensity that, is in the voices of clinicians and public health officials, it's because we don't want to end up in a situation where we get something like the India strain that is really, really infectious and mortal and kind of bypasses the benefits that we have with vaccinations. The good news is that we're already setting up boosters to see if we will end up needing to give more kind of protection against some of these new strains. And I think the India strain, as it's spreading, is going to be one of those that we're going to be testing against.
I think that's such an important point, because there is a sort of a feeling that if we've been vaccinated, then we're safe. But if we don't stop the virus from spreading throughout the world or other parts of our communities, that it does still have the potential to affect even vaccinated people. I also want to ask you about something that's happening over in India. They've seen an increasing number of COVID patients develop something called black fungus. What can you tell us about this?
So, infectious disease is a fascinating field because you kind of encounter all these different pathogens under different circumstances. So, this black fungus is a fungal infection caused by a pathogen known as mucormycosis, and it's actually prevalent everywhere. It exists in multiple environments. It exists in the soil. But if you have a good immune system, this is not an infection that you need to be worried about. However, what is happening in India is that it's, as I said, present in the soil and other kind of environments, and we're using steroids to help to treat people who have COVID. Steroids affect your immune system and compromise your immune system in the short term. And conditions like diabetes, which is quite prevalent in India as well, also compromises your immune system. So what has happened is we have individuals who've just had COVID, have gotten treated with steroids, and or also have complications like diabetes on board. And then they're exposed to this pathogen that basically lives in the environment, and they're getting sick. And what happens when you get this fungal infection is that it actually lives in the sinuses in the head region. And so what can actually happen is that it spreads in a way that it could spread towards the brain. And to treat it, you have to give medications, but you also sometimes have to do surgical resections of portions of the face. And that is incredibly disfiguring and problematic in so many ways. And so again, bringing down the rates of COVID becomes even more important in this environment.
If you haven't already, please get vaccinated. All right, Dr. Stella Safo, thank you.
Thank you.